Most people think kidney disease announces itself loudly, with pain, with dramatic symptoms, with something impossible to ignore. But that's not how it begins. In reality, kidney damage starts quietly, often years before a diagnosis. And by the time most people feel something is wrong, the damage is already advanced. What if the warning signs were there all along? Not in pain, not in emergencies, but in something most people dismiss every day: your urine. But urine is not the story. It's only the beginning. Kidney disease is one of the most underestimated health conditions in the world. Not because it's rare, not because it's untreatable, but because it stays silent. The kidneys don't have pain receptors in the way other organs do. They don't scream when something goes wrong. They adapt. They compensate. They keep working, even as damage progresses. This creates a dangerous illusion. If something were wrong, people think, I would feel it. But kidney disease doesn't follow that rule. By the time symptoms become obvious, severe swelling, breathlessness, extreme fatigue, kidney function is often already severely reduced. And at that point, treatment options narrow. The real tragedy isn't that kidney disease is hard to treat. It's that it's often detected too late. Before the body feels kidney damage, it often shows it. And the first place it shows up is urine. Urine is not waste alone. It's information. It reflects hydration, filtration, blood chemistry, and organ stress. When kidneys are healthy, urine stays relatively stable in color, clarity, and consistency. When kidneys are under stress, urine often changes. Foamy urine can occur occasionally, especially after rapid urination. But persistent foam is different. It can be a sign of protein leaking into urine, something healthy kidneys prevent. Protein loss is one of the earliest indicators of kidney filter damage. Dark yellow or amber urine often indicates dehydration. Dehydration forces kidneys to concentrate waste more aggressively, increasing strain. Chronic dehydration doesn't cause kidney damage overnight, but over time it raises risk significantly. A reddish tint can signal blood. Blood in urine may come from infections, stones, inflammation, or kidney damage. It should never be ignored. While diet can affect urine smell, strong or persistent odors may indicate improper waste filtration or infection. Changes in timing, frequent urination, sudden urgency, waking up multiple times at night to urinate. These changes often signal that kidneys are struggling to regulate fluid balance. None of these signs are dramatic. That's why they're ignored. As kidney stress progresses, signals move beyond urine. They appear in places people rarely connect to kidney health. Healthy kidneys regulate fluid balance. When they struggle, excess fluid remains in the body, often settling in the lower extremities. Swelling at the end of the day is common. But persistent swelling may be a warning sign. Fluid that isn't properly regulated can accumulate around the eyes during sleep. Many people attribute this to allergies or lack of sleep. But kidney function plays a key role. Kidneys help regulate red blood cell production and remove toxins. When they underperform, fatigue becomes constant, not relieved by rest. This is not ordinary tiredness. It's metabolic exhaustion. Kidney-related discomfort is often dull, deep, and persistent. It doesn't behave like muscle pain. It's often ignored until it's advanced. The most dangerous belief about kidney disease is simple: no pain means no problem. This belief delays diagnosis more than any other factor. Kidneys can lose a significant portion of their function without causing pain. By the time pain appears, kidney tissue is often already scarred, and scarred tissue does not regenerate. This is why early detection matters more than dramatic symptoms. Each kidney contains millions of microscopic filters. Their job is simple but vital: keep essential proteins and nutrients in the blood, and remove waste and excess fluid. When these filters are damaged, they lose selectivity. Protein leaks out, waste builds up, blood chemistry shifts. This damage doesn't happen randomly. Two conditions are responsible for the majority of chronic kidney disease worldwide. Number 1, constant high-pressure damages delicate kidney filters over time. Number 2, high blood sugar injures kidney tissue directly. Both conditions can exist silently for years, and both often damage kidneys long before diagnosis. Not all kidney damage comes from disease. Much of it comes from routine habits. High salt intake raises blood pressure and increases kidney workload. Modern diets contain far more sodium than kidneys evolved to handle. Non-prescription painkillers are widely used and often underestimated. Occasional use is generally safe. Daily or long-term use is not. They reduce blood flow to kidneys and increase injury risk. Waiting until thirst appears is often too late. Mild dehydration, repeated daily, compounds stress on kidney filters. Sleep regulates hormones that control kidney function and blood pressure. Chronic sleep deprivation disrupts this balance. Kidney damage is rarely sudden. It's cumulative. Here's what many people don't realize. Early kidney damage is often manageable. In some cases, progression can be slowed dramatically. In others, early changes can improve. But the window is time-sensitive. Once advanced scarring occurs, lost kidney function cannot be restored. This is why early testing matters, not when symptoms become severe, but when subtle signs appear. Protecting kidney health isn't complicated, but it does require awareness. It requires consistent hydration, balanced salt intake, thoughtful use of medications, regular movement, adequate sleep, and most importantly, basic testing. A simple urine test, a routine blood test, tests many people skip until it's too late. Every day your body communicates with you, not with alarms, not with pain, but with patterns. Urine is one of the earliest patterns to change. It's not random, it's not meaningless, it's a message. And the most dangerous kidney damage is not the dramatic kind. It's the silent kind. The kind you don't feel. The kind you ignore until it can no longer be ignored. If something changes, pay attention early. Kidney damage is silent. But knowledge doesn't have to be. Subscribe to keep learning the warning signs early before they become irreversible.